Hello, and welcome to the Portland Public Schools Reopening Guidelines, which focus on prevention strategies to keep students and staff safe while at school and to reduce the spread of COVID 19. Important protocols to remember include stay home when sick, cover your cough, continue washing your hands. If you have not had an opportunity to wash your hands, then avoid touching your face. There should be 35 square feet of space for every person in the room, and everyone should stay at least 6 feet apart. Everyone is to wear face covering while inside a PPS building, and surfaces are to be disinfected frequently. PPS staff should know the symptoms of COVID 19. They are expected to self monitor and stay home when sick. Nurses and student health associates may be asked to provide further evaluation for symptomatic students and staff if necessary. The primary symptoms of concern that are related to COVID 19 are chills, a fever of 100.4 or greater, cough, shortness of breath or difficulty breathing. Other symptoms related to COVID 19 infection include muscle aches, vomiting, diarrhea, and the loss of taste or smell. Again, it is important to stay home when you are sick or if you've been exposed to someone with COVID 19. Definition of an exposure is being within 6 feet of someone with COVID 19 for 15 minutes or longer. Remember, if you've had a positive test for COVID 19 or have COVID 19 symptoms and have been in close contact with someone who had a positive test, then stay home as directed by your healthcare provider or the health department for at least 10 days from the first onset of symptoms. Also, if you've had a recent close contact with someone who has tested positive for COVID 19, but you have no symptoms, then stay home until 14 days after your last exposure and monitor yourself for symptoms of illness. Again, make sure you notify your direct supervisor and a medical professional regarding any symptoms. Hygiene. After dismissal of an ill student, do not use the area until after cleaning and disinfecting. Wait at least 4 hours before disinfecting the space. If this is not possible, disinfect while wearing full PPE, medical grade mask, gloves, or gown if solely likely. Use EPA approved cleaning and disinfecting products provided by the school. Store cleaning products safely away from children. It is important to wash your hands frequently with soap and water for at least 20 seconds. This should be done before and after meals, after using the restroom, before touching your face, after sneezing, coughing, or blowing your nose, after caring for someone who is sick, after removing gloves, and after touching frequently touched surfaces. If soap and water are not readily available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Do not use hand sanitizer if your hands are visibly dirty or greasy. Wash with soap and water instead. To use sanitizer correctly, put enough sanitizer on your hand to cover all surfaces, then rub your hands together until dry. Supervise children when they are using hand sanitizer. Physical distance. Here are some of the ways Portland Public Schools is trying to support physical distancing. Having individuals keep 6 feet apart when possible. Maintaining 35 square feet of usable space per person. Possibly limiting the number of students in the building. Staggering schedules to avoid hallway crowding. If feasible, creating one-way traffic flow in hallways and stairs. And where necessary, creating markers on the floor 6 feet apart. Avoiding sharing supplies and keeping students' belongings separate. Acknowledging that some students will need additional support, learning to maintain distance. Avoiding congregating in break rooms, maintaining distance in staff workrooms. Offering web-based staff meetings and professional development. If it is not possible to eat at a workstation, such as a health room, offering a physically distanced alternative instead. Face coverings reduce the transmission of the virus that causes COVID 19. This graphic illustrates how the spread of COVID 19 is reduced as more people wear face coverings. As the graphic illustrates, when two people are interacting while both wearing face coverings, the risk of transmission is low. When these measures are not taken, the risk greatly increases. Face coverings are now required for all students and staff while inside a PPS building. Face coverings are a cloth or disposable face covering that covers the nose and the mouth. The CDC recommends that homemade face coverings be made of cotton with multiple layers of fabric. Wash a cloth face covering daily. If you're using a disposable face covering, be sure to use a new one each day. Remove and do not reuse cloth or disposable face coverings if they become soiled. Face coverings are now required for students 5 and older. In order to prepare young children to wear face coverings safely and effectively, students will need both instruction on wearing face coverings safely and effectively, desanitization support that will help get them used to wearing the face covering. In addition, families will need information on the recommended materials for homemade face coverings and proper care and cleaning instructions. Students cannot be disciplined for the inability to safely wear face covering. Face covering breaks may need to be provided for the students during the school day, with a space provided away from peers. Each school has a responsibility to ensure that students have access to usable face coverings. If a student has difficulty wearing a face covering, explore different types of face coverings that may work better for the student. Students should not wear a face covering if they have a medical condition that makes it difficult for them to breathe with a face covering, they experience a disability that prevents them from wearing a face covering, they are unable to remove the face covering independently, or they are asleep. To safely put on a face covering, wash your hands before putting the face covering on. Put the face covering over your nose and mouth and under your chin. Fit it snugly against the sides of your face. To safely remove a face covering, wash your hands before putting your hands close to your face. Handle the face covering by the ear, loops, or ties only. Avoid touching your eyes, nose, or mouth, and make sure to wash your hands after removing the face covering. Stress and anxiety have occurred throughout the COVID-19 pandemic in individuals with and without mental health conditions. As the school year starts, uncertainties and unexpected changes relating to starting and continuing the school year will occur in students, families, and staff. Providing accurate, reliable, and consistent information will help in alleviating stress and decreasing anxiety. Mental health resources are available for providing ongoing support as well as crisis intervention. Your own mental health is also important in order to provide stability and strength. Mental health supports in schools may include participating in the crisis response team, utilizing services from outside agencies, connecting with at risk students, being aware of the effect the COVID 19 pandemic could have on all students, and referring students to the school health center. Thank you for your time and attention in this training, and please email any comments or concerns to staysafe@pps.net.